Well, thank you, Mr. Chair, and I want to thank the ranking member as well for this hearing, and I want to thank the witnesses for being here today. And Mr. Sims, I want to start with a question to you. New Hampshire is one of 3 states, along with Alaska and Hawaii, that lacks a full-service VA hospital, something I've been pushing to change for years. Because we don't have a single full-service facility, many Granite State veterans receive care in a patchwork manner at clinics, through contractors, and across state lines. Mr. Sims, in your testimony, you said that the VA takes a data-driven approach to prioritizing projects. How does the lack of a full-service VA hospital in a state factor into that data-driven approach?
Thank you, Senator, for that question. I'll get specifics on New Hampshire, but in general, what it comes down to is the enrollee population and the projected service demand are laid against the available resources. And those resources include VA, community care, and other providers out there to determine where those points of care today exist or where there may need to be some in the future. But it is very local and very specific to different regions, as you pointed out.
Well, I understand that. I think one of the things we are looking for is assurances that without a full-service VA resource within the state, that there are different kinds of pressures on the other healthcare providers and different kinds of needs for the veterans. So this is a way of saying that I think the VA needs to better prioritize veterans in New Hampshire, Alaska, and Hawaii who lack a full-service VA hospital. And at a minimum, the VA should take the lack of a full-service VA hospital into account when allocating resources. I'm happy to work with the committee and with the VA to help ensure that that happens going forward. Relatedly, Mr. Sims, the current VA Medical Center building in Manchester is 70 years old, and it shows. Just a few years ago, the building had a major fly infestation that led to canceled procedures, and the VA has spent tens of thousands of dollars on exterminators to help address the problem. Our veterans shouldn't have to wait for insect infestations to clear up in order to get the care that they need. In 2018, a VA task force put forth a robust set of recommendations for VA care in New Hampshire, including an ambulatory surgical center at Manchester and numerous other changes to improve VA infrastructure. But 3 years later, Granite State veterans are still waiting for action on many of those recommendations. So, Mr. Sims, can you please speak to how the VA will make real, lasting change to its facilities to proactively address our veterans' needs rather than take a Band-Aid approach like hiring insect exterminators to fix issues that have a negative impact on care?
Thank you, Senator. That's a great question. And frankly, that's at the root of why we're driving toward recapitalization. There is only so much of that Band-Aid approach that you can take before you simply cannot make some of the changes or fixes that are necessary to continue support in those facilities without having shortages or stoppages of care delivery. And we certainly don't want that. There are some facilities that we need to look at fully recapitalizing. And this is, New Hampshire is an example. Manchester would be one that's of the right age, the right condition, that it would fit with many other facilities across the system that are in that discussion for where does recapitalization make sense to actually just wipe the slate clean and start new.
Right. It is rare that you call somebody Manchester, and the staff there is great. Veterans love the staff. They're grateful for the care they get. But you call, and there's almost always some facility issue that is interfering with care. It's not just an inconvenience. So I would look forward to working with you on that. Mr. Murray, I want to thank you for being here today as well. We certainly know how essential our veteran service organizations are in our communities. We're really grateful for them in New Hampshire. The VA must use a comprehensive approach in infrastructure planning that uses both data but also the input from veterans. Mr. Murray, can you please speak to why feedback from local VSOs is critical to infrastructure planning and how VA officials can use this information to inform their decisions?
Absolutely, ma'am. As part of the market assessments, the local veteran's voice is important to find out what services are needed, what services are desired. VA can't properly set up what they're going to put in their VA facility if they're not aware of exactly what it is they want. One of the things that we're also here to say, as you mentioned, some of the issues regarding facilities. That's stuff that our members hear about. That's stuff that veteran patients see about. As Mr. Orndorff mentioned, the 3% of operating costs would, if that was applied to VA's budget, that would probably align with what we think VA should be spending every year, but they don't have the capacity in order to do that. They don't have the personnel to manage that much work, that volume of work. So we think that looking at what organizations like Kaiser are doing and kind of applying that to VA would really help moving forward.
Thank you, and thank you, Mr. Chair.